Hey everyone, it's DJ Galicia Kid. Thanks for tuning in. Unfortunately, my guest for today had to reschedule, so you're stuck with me for the whole episode. But as always, after a quick music break, we'll be right back with our first segment of the show, so stay tuned. Thank you for staying tuned in. Just a quick reminder, the views expressed on RGV Community Health Hour are for informational purposes only and do not constitute medical advice. Be sure to consult your primary care provider for all your healthcare needs. So to start this segment for today's show, I want to start by talking about, by talking about the grad fairs coming up. So I saw online that there's going to be, our graduate fairs. Graduate College is hosting the grad fair in Brownsville and Edinburgh. In Brownsville, it's next Thursday, March 13th, from 4 to 6:30, and then the Edinburgh date is Thursday, March 27th, 4 to 6:30. And I was fortunate enough to make both events last year, Edinburgh and Brownsville, and it was really awesome to go and meet a bunch of other students, mostly undergrads who are interested in continuing their education, doing grad school here at UTRGV. And with that, just some more things from the post I saw. It says you can meet faculty and learn about research opportunities, get details on admission requirements and funding options, start or complete your application on the spot, enter to win a $500 scholarship just for attending, and the first 300 attendees at each location get a free t-shirt. And so, like I said, being able to do it last year was really cool because, for us in our PhD in human genetics program, like most other programs, the fall is the beginning of this, official year for the program. So this fall, it'll be the beginning of my fourth year. What I liked most about being able to do this last year was meeting students at these grad fairs, telling them about the program and what we do. And then now they're students in the program. So they're literally students that we recruited by going to these grad fairs. And then in the fall, I was doing orientation and presenting to them, about our student organization, GRASS, the Genetic Research Association of Scientific Scholars. So I highly recommend y'all check that out too. Go onto VLink and look up GRASS and be sure to join the org. And so, like I said, so I'm really looking forward to the interactions I'm going to have again because there were some priceless interactions last year at the grad fairs as well. So looking forward to meeting y'all. I hope y'all go out. I highly recommend it, even if you don't have plans to go to grad school right away. And actually, some of the students we met are actually still undergrads from last year, and they're volunteering in our lab. So they just went, out of curiosity, I guess, because they're a couple years away from graduating. But they learned about the opportunities, and now, they're in the lab helping us do our work. And hopefully, after they graduate, they can consider joining our program as well. So highly recommend y'all go out there, and y'all, like I said, more than likely I'll be able to get to both events on March 13th in Brownsville and March 27th in Edinburgh. So hopefully, y'all can make it out and meet me, DJ Galicia Kid, there. It'll be a lot of fun. And if you are listening to this and you go because you heard me tell you about it, on my show, mention that you heard it on the show, and maybe I'll have some special swag to give you. So hope to see y'all out there. Other than that, I do want to talk about a little bit more about the ACS Ken event that I did last week. Was it last week? Yeah, I'm pretty sure it was last week. Sorry, I've been coming to work and school. I live in McAllen and I commute to Brownsville every day, and I've been coming for like 25 days straight because of my experiments that I'm doing have me working through the weekends. So other than that time in Austin that I spent, I have been coming here every day for basically a month straight. And so all these days are blurring together. But with that said, that time in Austin was really really awesome. I had mentioned it before, it's very humbling being able to go and, not only, to go and represent and have a voice for cancer patients, survivors, researchers, and the, everything that kind of falls under that umbrella. And then, of course, to be able to have my little group that I was in with, we were in a group of 3, and I was with 2 women who were breast cancer survivors. And, I probably mentioned some of this in last week's episode. But yeah, it's always so awesome to reflect on those moments and just think about how basically, I guess the easiest way I can kind of describe this is by my conversation with one of these ladies, just so I could never imagine what they had to have gone through, obviously being diagnosed and going through chemo and getting, these powerful treatments to help them survive. And that's basically, I was trying to talk to, her name's Ashlyn. I was trying to talk to Ashlyn about, the ups and downs of life, because, regardless of your financial status, social status, or any of those things, life hits you regardless. And we're going to have our ups and downs. And that's why it's important to, and that's why when I was talking to her about this, I was like, man, I feel like I'm preaching to the choir, because if there's anybody that understands having to go through those ups and downs, it's people who have, gone through treatments like that or get diagnoses like that. Because, one day life can be going good, and then the next day you get a call from your doctor, or you might start feeling weird or things like that. But with all this said, I just wanted to, loop around just talking about mental health, because like I'm saying, life is hard, and it's regardless of how much money you have or your job title or any of that stuff, it's going to have its ups and downs. And that's why it's really important and really hard to try to stay centered, right? Because whenever something goes bad, you want to, and there's nothing wrong with crying and just, feeling down or maybe depressed for a little bit, but it's important to not stay in those states, because inevitably something good is going to happen. And when that happens, you got to be able to recognize it, because when you're in such a deep depression, there's a lot of times that, you're just got this dark cloud over you, and it's hard to see the little blessings in every day. And then whenever life goes well, you get 100 on your test, or you get a promotion at work, or, your kids, make the A honor roll or get into college or whatever it is, it's going to be this great feeling, but it's going to be fleeting, right? So it's great news and it feels great, but eventually, that high of good news or whatever, it's going to fade away, and and that's why it's good to stay kind of level as much as you can. And I know it's hard to do a lot of times, and you have to consciously think about doing it. But I highly suggest that you all, take time every day for yourself, whether it's going for a walk, just taking some time to do a little bit of conscious breathing, because I feel like, me personally, I do breathing exercises, and that's what helps me basically with my trying to stay level and calm. And I also do, what do they call it? Sorry, I'm blanking right now. Mindful meditation. So I mindfully meditate, and I've mentioned it here before too. So it's very easy. We're really good at beating ourselves down all the time, thinking like, man, I'm not good enough. I'm not smart enough. I'm never going to be able to do X, Y, Z. And so spending just 10 minutes a day verbally out loud saying things like, I am smart enough, I am capable, I can do it, I've done it once before, I can do it again, I am capable, I do belong. Just reinforcing these messages out loud. It sounds crazy, but I promise you, if you spend the next music break just thinking positive thoughts like that, you will feel physiological changes, whether you believe it or not, right? So you can say, I'm smart enough, I am capable. And even if you, in your heart of hearts, don't believe it, you just verbalizing it will start to like change you. Because I've felt this before, and I feel it often because I deal with a lot of imposter syndrome doing the things that I do and working with the people that I work with. And I know that's not an uncommon feeling, because some of the students in my program, of course, we have a WhatsApp group together. It was shared. Okay, let me back up a little bit. We have a postdoc, and I hope to have him as a guest on my show. We have a postdoc from Morocco who's visiting for 6 months, and he wrote an article that came out in Science, I want to say, which is like a publication. But yeah, so he basically, the title of the article is like, man, I had imposter syndrome. It basically is something like, hey, I didn't think I belonged in a research setting until I learned that a lot of other researchers feel that way too. And so yeah, we're, like I said before, we're really good at beating ourselves up, and it's really important to take some time out of your day to reinforce positive thoughts, because you are capable, and you are able to do great things. It's just a lot of times we put up our own barriers, and then we have to knock them down by doing these breathing exercises or mindful meditation or running. I love to run. I haven't done it in a while, but yeah, I love to run. I love to be active. I love to go hiking. There's a lot of things I love to do, and it's important to take time out of your day to do them. So with that, I'm going to head out to a music break. So try to think those positive thoughts, and I promise you it's going to change your day for the better. So stay tuned, everyone. We'll be right back. All right, everyone. Thanks for staying tuned in. Hope you took some of that time to do some mindful meditation and reinforce those positive thoughts. So for the second half of my show, I wanted to spend some time talking about something really relevant here to the RGV, healthcare challenges in the colonias. So if you're not familiar with what colonias are, because I wasn't until I started, going to school for doing my human genetics program, colonias are unincorporated communities near the U.S.-Mexico border with limited infrastructure and resources. Thousands of families live in these areas, often without basic services like clean water, sewerage, or healthcare access. And sorry, and a way I kind of think about that is, so I grew up in a small town called Freer. Shout out Freer. It's a small town between Corpus and Laredo in Duval County. And the way I usually explain it to people is, if you know where Alice, Texas is, so if you go west of Alice, you hit San Diego, and then west of San Diego is Freer. And and so I grew up on a 100-acre ranch out there, and and we used well water, and we had we didn't have a septic system. We just had a straight pipe that ran to a hole in the ground, basically away from where we lived. And so when I think about what a colonia is, that's kind of the way I think about it. Of course, there might be more, populous in terms of neighbors and things like that. Because out there in Duval County, yeah, you might have neighbors in your little ranchito, but they're not going to be as condensed here as the colonias are in the valley. And so, I guess that's really the only personal experience I have in terms of it. So part of the program, one of our lab rotations we have to do is learn about the colonias and learn about how we do surveys to try to figure out lifestyle habits and things of that sort. Kind of like when you go to a doctor and they ask you, about your sleep and your exercise and your, alcohol intake, or if you smoke. So we go out there and use surveys to try to get a better understanding of what the community needs and what the challenges they face. And so some of the barriers to healthcare access have to do with the lack of transportation, because many Colonia residents live far from clinics and hospitals. And, it often makes it hard to seek medical care. And that was one problem growing up in Freer was really, we had a clinic that was open maybe a couple of times a week. And depending on the years, I feel like sometimes there was a full-time clinic sometimes. And then, the services come and go. And so that made it really hard for anybody to, if you wanted to go see a doctor, it was going to be a time and an expense to do that versus like living somewhere in a bigger city or somewhere local to services like that. And of course, many people in colonias don't have health insurance, making doctor visits and medications unaffordable. And so, I know UTRGV is doing a lot to try to help, bring the burden of these barriers down by, I can't remember what they're called, AHEX, I think is what one of the MDs in our program called them. I think it's called AHEC. I can't remember off the top. I think it's like something health clinic. They're basically like student-run health clinics, of course, with the expertise of the medical doctors. But the medical students is kind of how they get their, some of their experience. And I don't know if it counts towards like their residency time or what. But yeah, so these clinics are low-cost places where people can go to get healthcare. And of course, many residents only speak Spanish. And some fear seeking care due to immigration concerns, especially these days, right? And so that's another part of the, what's the word I'm looking for? Not trouble, but, I guess the stigmatization, I guess. I don't know even if that's the word I want to use, but, and unfortunately, speaking Spanish can be frowned upon in some places, especially not so prevalent to places like this. But I've known people that have told me like them and their coworkers are speaking Spanish at work and were told by their manager to stop speaking Spanish. So yeah, there's always those stigmas based on your language or your accent, right? And then the contaminated water, lack of sanitation, and exposure to pollutants increase health risks. So, of course, like I've mentioned on the show before, our environment, all the environmental hazards, have the potential, as my guest before, Dr. Vince Diego said, that, the environment modulates our genes. It affects the way our DNA gets read and our genes get expressed, which could cause health issues. And some of the most pressing health issues, of course, are diabetes and obesity, infectious disease due to that poor water quality and lack of sanitation can lead to waterborne illnesses. And one thing I know personally is the respiratory illness and mold exposure. Many homes have mold or poor ventilation, worsening asthma or other conditions. So I've been on the wall of, just trying to decide whether I want to become a mold consultant or not. Because of my experience and educational background, I can become a mold consultant for the state of Texas. So just so this is out there in the universe, if you didn't know, if you buy a home, hire a mold expert, because the home inspectors, it's not their job. The way the law is worded is the home inspector is not required to disclose the absence or presence of mold. So they literally go on into homes that they're inspecting with mold blinders on. They do have the option, of course, to let the homeowner know, like, hey, I see some weird stuff growing in your vent. Maybe you should hire an expert to come check it out. But I'd have to say more often than not, it's probably not happening from my experience anyway. And then, of course, many pregnant women lack prenatal care, leading to complications. And, I saw a really interesting research paper done on pregnant women in the McAllen-Edinburgh area, where they had these pregnant women wearing a backpack that was essentially a filter and an air pump just to see, of course, you're just running this, pushing this air that these pregnant women were exposed to, and not anything crazy, right? Just their day-to-day, living. They just carried this bag with them, and it took samples of the air and what they were exposed to. And then, these researchers took those filters and figured out, the different contaminants or air pollutants, I guess would be a better word, that they came across. So it's a really interesting paper, and I will make sure that I bring that in with me next time so I can read a little bit off of it, because I think I'll find it really interesting. And so I think, just to go into some of the solutions, like I mentioned before, UTRGV is working really hard to bring down those barriers and get more people, in the community to take their health seriously. Well, I guess that's not the right word either. But just to, be more cognizant that, maybe in the past, because I didn't grow up in the RGV, so I'm only speaking from what I hear for other people say, is that now, with all these different medical clinics, and like I said, UTRGV doing their podiatry and this human genetics and the neuroscience and cancer research center that they're opening up, or I'm pretty sure that's happening here. I'm sorry. It's just a bunch of million things going on in different parts of my, my different networks, right? So there's something opening in San Antonio in a couple of weeks that is, I can't remember what it's called now. It's basically a free lodging. I think they call it the Hope Lodge, maybe. It's for people who are going through treatment, where they can have a place to stay without, having to get a hotel or basically minimize their expenses for treatment and getting seen. So, yeah, there's a lot going on that UTRGV is doing. And part of that is, bringing the healthcare to the colonias. So, like I had mentioned before, part of our lab rotation for our human genetics program was to go out to the colonias and actually go into people's homes and administer the surveys and talk to people. And it was really, another moment in my life while I was like, wow, man, this is like, I'm really thankful and grateful that I get to learn from these experts and get this experience, hands-on experience, right? Like in the, quote unquote, in the real world, going out to these colonias and talking to the community and just letting them know, like, hey, we're here for you and we care about your health and your well-being, and be sure to use these resources. And then, of course, there's nonprofit organizations, government assistance programs. Shout out again, as always, to Elvia Gibbs and TTs for Tatas Foundation, who help women with their, expenses of getting screened for breast cancer and things like that. So definitely check them out as well. So there's different organizations and, programs like that to help people out, whether they're mobile clinics or, going to the colonias directly. So with that, we're going to take another quick music break, and we'll be right back for the last segment of the show. So stay tuned. All right, everyone. And we're back. Thanks for staying tuned in. So for this last segment, not a lot of time left, have about 5 minutes or so. And I just wanted to spend some time talking about the importance of being prepared for an emergency, in especially when it comes to having your medications and the things you need on hand, right? And I think that was a bit of a problem during the pandemic, if I'm remembering correctly. In terms of people having to get prescriptions filled, or just getting access to what they need. And so because we live in a region that's prone to, even though it hasn't happened in a while, prone to hurricanes, people with chronic conditions like diabetes or asthma, definitely to keep that into consideration, making sure that they have enough medication on hand in the event of an emergency. And thankfully for things like hurricanes, versus a tornado or a storm like that, something that you can't really predict versus a hurricane that we can have some time to prepare. So with that, just wanted to tell you to, always keep those things in mind, right? It's the same, no different than going to getting the gallons of water or the cans of food. You got to remember to, pack all, not pack all your essentials, but have all your essentials on hand in the, in the off chance of an emergency. So me personally, we have a bunch of medicine on hand just because I have 2 young daughters, but other than that, I do have other supplies. I'm always, I always make sure I have clean water on hand because you never know what's going to happen. And water, of course, as everyone knows, is important. And, basically have, also in my car, because I commute so much, I have a bunch of first aid stuff in my car on the off chance that, I witness an accident and have to try to provide aid. And so it's always just good to think about those things. And of course, on top of that, because I commute so much, I have like a little portable air pump, little jump battery pack for my car if it doesn't start. So as it's no different with your, personal vehicle, right? Having a little roadside emergency kit, you should always have something like that at home as well. So one last thing I'm going to end with is that I am going to be attending the Texas Genetic Society meeting that I had mentioned, I think it was last episode. But yeah, so I'll be attending the Texas Genetic Society meeting later this month in about 2 weeks, and I'm really excited to go, and I'm looking forward to going and learning about, the various programs and, of course, career opportunities, and also just being able to network with other genetics researchers and learn, go over there and watch their presentations and check out their posters and continue learning. So really looking forward to that. And I can't wait to come back and share it all with y'all in terms of what I learned. And hopefully I can have a guest come on that may be, attended as well in the hopes of, having some good conversation to talk about what we learned. Maybe, and actually, Dr. Megan Kinnery, who I had mentioned before, she is now the president, I want to say, of the organization. So it'd be really cool to have her back on. I had her on last October because she's also a breast cancer researcher. And so yeah, it'd be really cool to have her on. So maybe I'll reach out to her, but you got to stay tuned to know for sure. But that's all I got today, everyone. This is DJ Caliche Kid telling you to stay curious, stay healthy, and let's thrive together, RGV.